Well, the state is clear about who should get the vaccine next, but Denver's mayor is asking the governor to rethink that plan.
Denver Mayor Michael Hancock is asking the state to add our homeless population to the list of those who can get the shot right away, regardless of their age. He says they are some of the most vulnerable during this pandemic.
And tonight, Denver 7's Sloan Dickey is taking this issue 360, asking whether Colorado should look at housing status as well as age and occupation when making these decisions about who's next in line to get the vaccine.
We've seen great eagerness from people experiencing homelessness to get vaccinated.
As vaccines roll out for vulnerable populations across Colorado, one vulnerable population, people experiencing homelessness, gained a strong public advocate.
Here in Denver, we have a much stronger need because of the size of our persons experiencing homelessness.
The city of Denver is urging the state to prioritize homeless residents in its vaccine rollout rather than strictly adhering to the state's age-based approach. The move has stirred opinions on all sides, and we're here to share them with you. In tonight's 360, you'll hear from a range of people, including city employees, homeless advocates, and Denver residents. And you, our Denver 7 viewers, have strong opinions. First, what led the city to decide it needed to prioritize Denver's homeless population?
We have a high rate of people that are at high risk to negative consequences from COVID-19, and we have congregate living settings.
Currently, the state does not prioritize its unhoused as a vulnerable population.
It doesn't make sense to go to a shelter where there might be 300 or 400 people and only vaccinate those that meet a certain age requirement or that have a certain healthcare condition.
Kathy Alderman of the Colorado Coalition for the Homeless says vaccinating those in homeless shelters is a huge step to preventing hospital overflow and helping flatten the curve.
People that are experiencing homelessness are more likely to require hospitalization. An outbreak within a shelter where 250, 300 individuals might be could put enormous pressure on the hospital system.
Advocates say homeless means vulnerable.
I think it's well-founded. I think people who cannot retreat and keep themselves isolated from other people by necessity probably have a great need to have the vaccine available to them first.
But the governor's plan focuses on age and occupation, starting with those 70 and up first responders, and now adding those 65 to 69 to the vaccine list, and educators. We've reached out to the governor's office on the potential to prioritize homeless. We're still waiting to hear back.
It should be based on age overall and pre-existing conditions.
So many of you are weighing in on social media. Barbara writes, "Are you kidding me? My husband is a liver transplant with no immune system, and I'm 68 and number 58,000 on the Kaiser list. Who comes up with this nonsense?" Tyler writes, "Probably should focus on taxpayers first." And another Denver 7 viewer writes, "Shouldn't they be just as much a priority as the rest?"
I think that's a scientific decision, really, to determine what is the risk reward in terms of, particularly severe illness and death.
Even if the state decides to prioritize its homeless residents, a major disagreement remains. Should the vaccine go to all of Denver's unhoused or just those living in shelters?
While we would love to see more planning take place for people that are sleeping outside or that are in encampments, we're really focused on these congregate settings.
Regardless of the answer, the reality of Denver's vulnerable population on the streets is hard to ignore.
Those of us who can retreat and social distance, we can wait a few more weeks until the more vaccines come out, because the homeless can't wait a few more weeks until vaccines come out.
Sloan Dickey, Denver 7.
And public health doctors say there are many factors at play as to why those who are homeless are more likely to catch the virus and can have a more severe case of COVID because of it. First up, social distancing is difficult when you're sharing a tent or living in a shelter with dozens of other people. And for many, the viral infection comes on top of other health challenges.
They often have a lot of what we call comorbidities, other underlying risk factors that might make them more likely to get seriously ill due to COVID-19, either because of inadequate access to medical care, uncontrolled diabetes, all sorts of underlying conditions that may make them more likely to be sick.
Denver's mayor says the rate of COVID hospitalizations among the homeless is 3 times higher than the city average. All right, now we want to get your take. Should homeless Coloradans move up the vaccine priority list? You can email us 360@thedenverchannel.com.